Everyone who's done a surgery residency in the United States has cared for patients with gunshot wounds, and that is not normal. That is not standard. That is not typical in other countries. That is a uniquely, exceptionally American thing, especially if you do, like I did, a general surgery residency that involves a lot of time spent on the trauma service. You are going to see patients with gunshot wounds. I've seen patients with gunshot wounds to their extremities, to their intestines, to their stomach, to their liver, to their lungs, to their heart, of course, to their head, to their neck, to their arms, to their legs. I have seen all of it. The reality is the majority of these patients die before they make it to the hospital. They die either where they were shot or they die on the way to the hospital. That means in general, we are taking care of the patients who have less severe injuries, because those with the most severe injuries will never even make it to the hospital. Some patients are so unstable, meaning they've lost so much blood and their blood pressure is so low that they need to have something called an ED thoracotomy. Have you heard of that? Do you know what it is? It is when they open up your ribs. Here, cut in between your ribs, crack them open to access your heart and your aorta and your pulmonary arteries, because that may be the only chance at saving you. When that happens, it's not like what you've seen in movies and on TV where there's a controlled setting in the operating room, nice blue drapes over everything. No, you're lucky if you got some betadine just thrown on your skin before somebody made an incision as quick as they could through your skin and your fat to get all the way down to the level of your ribs before spreading your ribs open. Sometimes, depending on the type of injury, they might need to do something called a clamshell. What that means is that you have an incision that goes all the way from one side across the front of your chest to the other side, and both sides, your ribs are spread open. Both sides, so they can access your lungs, your pulmonary arteries, the aorta, the heart, all the structures in there from both sides, depending again on the type of injury. Now, I'm not sharing that because that's what happens to every person who gets shot by a gun. But why I am sharing that is that could happen to you just as easily as it could happen to me in this country where we live, where we think guns are more important than children, where we think it is more important to have the right to have access to assault weapons than the right to keep ourselves and our families safe.